Over and above the side effects that have been well documented about these medication, parents are often concerned about other side effects which they read about on the internet or in the news or in popular newspapers or magazines. And we need to look at these complaints because if we don't address them, parents will be very reluctant to use medication. There's a few big scares out there, and I understand that parents take these seriously and therefore have major concerns when doctors prescribe medication for their children with ADHD. The first one is it going to make my child a drug addict if I'm going to give him medication that is a Schedule 6? And why are these stimulants Schedule 6? By the way, non-stimulants are Schedule 5. And they really cannot be abused in any way, so they're not part of this discussion. So we are going to focus on stimulants now. There are various ways that one can utilize medication. First of all, you can use medication. That means you use medication as prescribed by a doctor. Secondly, you can misuse medication. That means it's medication prescribed by a doctor, but you don't use it in exactly the way that he prescribed it, which we see a lot among students that are studying now. And then there's abuse, which means you are using the medication to get an effect that is different from the reason why the medication was prescribed. And that is the drug abuse that we are referring to. One can get addicted to stimulants, not by taking it orally, but by taking it through other means, such as either sniffing it like cocaine, or otherwise mainlining it, or intravenous injection like heroin. You have to use many tablets to do that. You have to crush them, about a month's supply to get a high. It's not a very good high. It doesn't last very long. And most people that start with these kind of abusive techniques will go on to heavier drugs such as cocaine. Cocaine has similarities with stimulants in the sense that they both increase dopamine, but cocaine actually has a very rapid onset of action, something like 3 seconds, and it eventually will destroy the cells that it affects, where stimulants don't actually enter cells, they work from the outside, and they don't have any long-term effects on brain cells. So the first thing is one can get addicted to the medication if you don't take it the way that a doctor prescribes. In fact, in the very small doses that we prescribe, it is not addictive at all. The second issue is that there is an area in the brain called the nucleus accumbens. That area is the area that makes you feel good about yourself. It's the area that makes you feel stroked, that develops your self-esteem. If you have not been treated on stimulants for your ADHD, your chances of becoming a cocaine addict is much higher than the normal population. In other words, treating children with ADHD on controlled oral medication prevents them from becoming drug addicts to that extent. And their chances then becomes the same as the population. And in some studies from Harvard, even half of what the population normally, the prevalence in the population would be. So if anything, treating children with ADHD timeously and effectively, if it's possible, prevents them from becoming cocaine addicts as adolescents and adults. The second scare is that of sudden death. There are certain companies who have made a lot of noise about this. There's a lot of misinformation around. And of course, that's scary for parents when they read that Ritalin can cause sudden death. There has been some cases where people have had sudden death when treated with Ritalin, and the majority of them had an underlying cardiac abnormality, so much so that we now have to ask about specific symptoms before we can prescribe medication. But the latest research has shown that there are no more people with sudden death in the Ritalin treated group than in the normal population. Sudden death happens to anybody at any time, and it is not necessarily linked to stimulants. The third thing that bothers parents is that there has been, again, some articles in the news in the last few years that stimulants increases your likelihood of developing cancer. And again, that has been shown to be misinformation, and that is not true at all. Lastly, I think parents are always concerned about their children's growth. And this whole thing about growth stunting and stimulants is worrying. For me, the best information regarding this topic comes from France, where a big study showed that, in fact, it's the ADHD that makes children shorter and skinnier and not the medication. In France, stimulants are hardly ever used for ADHD. They followed up over 1,000 children that had the diagnosis, was never medicated. They all started bigger and more overweight than their peers. They all ended smaller and skinnier than their peers. It has to do with their hyperactivity, their poor eating, but especially poor sleep. You secrete your growth hormone when you sleep, and if you're not having good sleep, you certainly can be shorter. I think we should have to put this whole growth thing to rest. I am certain that children on medication are a little bit lighter or skinnier than their peers because their appetite is suppressed, but any long-term effects on height and weight is probably exaggerated.